Infectious Disease, Feline Panleukopenia, Shelter Medicine Final. Authors Sandra McWhorter, Thalia Nolder, Paula Plummer, Callie Puckett, Medina Regalia, and Olivia Reynolds for Tarleton State University. Introduction. Feline panleukopenia can be a devastating disease in young cats or old, immunocompromised cats in a shelter. This disease is a DNA virus that can cause severe dehydration from vomiting and diarrhea. This virus is like the canine parvovirus in puppies. The cats will have many of the gastrointestinal distress or upset signs when they have this disease. If not treated as soon as possible with supportive care, the cats can pass away. Prevention is key to helping the cats not get this disease when they come into the shelter. The feline panleukopenia virus is a DNA virus. This means that this virus is replicated in the nuclei when the cell is dividing. When the cat gets infected, the virus replicates and the cat starts to show signs of the disease about 5 days after infection. The virus replicates in the oropharynx and the lymph nodes that are by the oropharynx. This disease is in the family of Parvoviridae. We also call this disease feline distemper instead of calling it parvovirus. This can be endemic in groups of feral cats that are not vaccinated. In pregnant queens that become infected, we can see them abort their litters. There is a high mortality rate to this disease, most likely due to the dehydration caused by the clinical signs. The pathophysiology during specific life stages is different for each stage. In the early fetus, we can see teratological changes that may lead to resorption of the fetus, abortion, or stillbirth. The late fetus or neonate, we see evidence of external granular layer forming on the cerebellum that leads to hypoplasia and incoordination with tremor. Older kittens, we see the epithelium of the ileum and jejunum affected, leading to enteritis and diarrhea. In adult cats, we also see affected ileum and jejunum, and the virus can then spread to the thymus, bone marrow, and lymph nodes. If left untreated, the cat may then develop leukopenia, thrombocytopenia, and anemia. Transmission of the panleukopenia virus comes from all secretions of an infected feline. Direct contact with the infected cats is the primary source of easy transmission. The environment also may remain infected for years. Fomite transmission in the shelter may be prolonged due to the extended survival time of the virus. Within a shelter, it may be difficult to slow the spread of this easily transmitted virus. All recovered cats and kittens must remain isolated for at least 14 days post-recovery to ensure they are no longer shedding the virus. Repeated laboratory tests should be done to keep the rest of the feline population in the shelter safe. So who can be infected with feline panleukopenia? Cats of any age can become infected with this disease. Our most at-risk populations are young kittens that have immature immune systems, ill cats that have a compromised immune system, and unvaccinated felines. The most common age of infection is 3 to 5 months, and death is more common at this young age. This virus has been diagnosed in every country in the world. However, our most high-risk felines are ones that are housed in either kennels, pet shops, animal shelters, the unvaccinated or feral cat colonies, or any other group housing that has a positive case. Urban areas do tend to see a higher outbreak than in warmer months, when cats are more likely to be encountering other cats. The most common clinical signs include vomiting and diarrhea, which can lead to dehydration. They also include depression and lethargy. This virus causes a drop in the white blood cell count of the feline, so they therefore become immunosuppressed, which then increases their susceptibility to other infections and diseases. Affected animals typically display behavior of leaning their heads over their food and water bowls. Severely affected animals may die within 12 hours of showing symptoms. Diagnosis is primarily made through the evidence of clinical signs, as well as doing a complete blood count showing moderate to severe panleukopenia. A PCR testing can be used to diagnose feline panleukopenia virus through the use of feline feces as well. The results may come back as a false positive if the feline has been previously vaccinated with the modified live virus within a 2-week period. False negatives may also occur if the animal is not currently shedding the virus due to the disease being either in late or early stages of development. The primary method of treatment for panleukopenia virus is supportive care. This includes subcutaneous and IV fluids to maintain hydration and to reduce the incidence of diarrhea. If the cat is vomiting consistently, an antiemetic should be given to control. If a cat is able to survive more than a few days while being on supportive care, then the feline is expected to develop an adequate immune response which can help overcome the infection. Continued treatment for these cases may include force feeding after the vomiting is controlled. The use of broad-spectrum antibiotics can be dependent on each case, but they should be able to penetrate the GI to cover any E. coli pathogens that are perpetuating any infection. If this illness has caused excessive vomiting, it is usually advisable to assess the animal's liver enzymes to monitor during this treatment. The best way to prevent cats from getting feline panleukopenia is to vaccinate them. Shelter cats should be vaccinated upon intake and then every 4 weeks until they are 16 to 20 weeks old. Cats suspected of having the disease when they arrive at the shelter should be placed in a separate isolation room to prevent the spread of disease to otherwise healthy animals. Another way to prevent this disease from spreading is by proper disinfection. All areas that the affected cats have touched should be thoroughly disinfected in order to prevent cross-contamination. This should include all intake areas, treatment areas, as well as their caging units. 2 examples of commonly used disinfectants effective against this virus are bleach and also quaternary ammonium compounds that often have a much more pleasant smell than bleach. Once a cat is deemed infectious, they must be moved to isolation. The isolation area should be in a separate area of the shelter and must be easy to clean and disinfect. No carpet, furniture, wood, or grass should be kennelled with these animals, since it is difficult to clean. Isolation should have its own supplies to include litter, litter boxes, laundry, food, and cleaning supplies. These areas should also be the last in the shelter to be cleaned. Cats infected with this disease should be handled as little as possible with appropriate personal protective equipment. Infected cats should be isolated for 14 days past the resolution of any clinical signs, along with a confirmatory negative snap test. A negative snap test proves that significant quantities of the virus are no longer being shed. Cats should never receive a bath to remove any residual virus on their coats before being reintroduced into the general population. Prognosis for this disease is often guarded, and it depends on their life stages. Kittens less than 8 weeks of age have a very poor prognosis. Older cats have a higher survivability rate if they do receive adequate, proper supportive care. Without supportive care, up to 90% of these cases have a grave prognosis. Surviving cats often will have lifelong immunity, but prevention is key. Owners should be told that kittens need to be vaccinated between 8 to 10 weeks and then again after 12 to 14 weeks, and yearly boosters are recommended for all cats. There are new studies that have shown that current vaccine immunity may last up to 3 years. That would be up to the individual veterinarian and your state and local regulations as far as if they can just run a titer before immunizing your pet. In conclusion, panleukopenia is a DNA virus that is easily spread among cats. Because of this ease of transmission, in a shelter setting it makes it very difficult to control. Vaccination is the key to preventing this disease, and any sick animal should be isolated immediately to reduce the risk of spread. Proper disinfection of the kennels and treatment areas will prevent the disease from infecting at-risk felines. References used. Image references. Image references continued.